You know, with Breast Cancer Awareness Month wrapping up, we wanted to shine light on an important topic, the risk of reoccurrence after treatment. Here with more is UT Physicians orthopedic surgeon, Dr. Dennis English. Dr. English, welcome to the show.
Thanks for having me, Courtney.
This is a really interesting topic, too, that I think so many of us really need to have this conversation because the message here, I think, number one, that we need to get out is listen to our bodies and really understand that gut feeling. If you think something is out of ordinary, out of sorts, see a doctor.
Absolutely. So thank you for having me. First off, I appreciate it. I'm an orthopedic surgeon and I specialize in bone and muscle tumors, both tumors that start in the bone and muscle and also tumors that start in other organs and metastasize to them, breast cancer being one of the most common, actually. And so I meet several patients per month that have had a history of breast cancer many years ago and have developed hip pain or knee pain or possibly back pain. And so what we want to do is make patients aware and do some community engagement regarding the possibility that breast tissue and cancer can travel to the bone and affect it in a negative way, destroying bone and potentially leading to pain and possibly fractures as well.
Doctor, how does this happen? I mean, once you have cancer and breast cancer, why is there a simple answer of why it metastasizes, can return back and affect the bone?
So there's not a simple answer to why certain cancers do and why certain cancers don't. As physicians, we have an understanding of certain cancers that do travel to the bone more commonly than others. But why does one woman get breast cancer that travels to the bone, be it immediately after her initial diagnosis or years down the road? We don't have an answer to that. We do have an understanding of some of the mechanics of it and some of the science behind it. So I think we're making some good progress. But one of the realistic issues is that with great chemotherapies and our wonderful oncologists, patients are living for a longer time now. And unfortunately, these medicines don't always protect the bones and the cancer from traveling to the bones.
And I think what's interesting, too, here, and this is a point I think we need to stress, is that breast cancer can affect anyone, even without a family history of that disease.
Absolutely. I couldn't agree more. And so I think that it's important to, do your regular screening, talk with your oncologist, and mostly listen to your bodies. And so, if there's a pain to the back or pain to the hips or pain to the knees and you have a history of cancer, I think it's really important to ask your primary doctor, take a very simple x-ray. It's very low cost, low risk, low radiation, and can be a wonderful screening tool.
Well, we know that we're going to keep you right here, doctor, because we've learned that breast cancer, of course, after the break, we know that breast cancer can return and spread to a patient's bones. And that's exactly what happened to our next guest. We're going to hear her story right after the break. Of breast cancer when it returns in a different location in the body. Joining us back is UT Physicians orthopedic surgeon, Dr. English, along with his patient, Jennifer Bridell, whose breast cancer journey began in 2016. Doctor, welcome back. And Jennifer, nice to meet you. Thanks for joining us today. You are also a registered nurse, and talk to us about what you first noticed back in 2016 when you thought something was amiss.
Overnight, I woke up with a lump. That was very painful.
And you were very vigilant about self-checkups and routine mammograms, is that right?
Yes, I just had a mammogram 7 weeks prior that normal.
And so your diagnosis basically came shortly after that with breast cancer. And in May of 2016, you started treatment. And yes. July of 2018, you completed treatment. And you were basically pronounced no evidence of disease. And we're looking at some photos. I'm guessing that is of after treatment as well. And what was that like going through all of this for you?
The first time, very difficult. I had no idea, even as a nurse, what it was going to entail. The chemotherapy is really hard on your body. It's important to follow the direction of the doctor, do everything they tell you to do. It's so important in order to get through it because it is so bad, meaning like fatigue and losing your hair is nothing compared to what else can go wrong.
Right. And then fast forward, if we will, 2 years later is when you felt some different pain. And was that localized in your hip and leg area?
Correct. My right hip and my right leg. And I also had just had scans 5 months prior. So it was looked at as my low back, and we'll watch and see.
And that's basically when, Dr. English, you were called in and looking at her scans. And this is why we're talking today, because this is what can happen when the cancer metastasizes to the bones. This is what was the course of action next.
Exactly. So first off, I'd like to congratulate Jennifer on doing a great job with her surveillance scanning and sticking with her oncologist, Dr. Kadali. So I think that she was in good hands, and they had regular checkups for her to make sure that the breast cancer had not traveled anywhere else and not recurred. And we do these at certain intervals, and sometimes with especially aggressive cancers, it could come back in between those intervals. And so for Jennifer, the cancer started in her, or went to the femur, and the cancer produces chemicals that destroy the bone and lead to pain and eventually fracture. And so when I met her, she had come into the emergency department because her leg was broken.
And I understand, too, that recently, October 14th, you completed your radiation, you rang the bell. It's an interesting and timely topic. And thank you both so much for being here today, Dr. English and Jennifer Bridell. Thank you for sharing your story.
Thank you.
Thank you for having us.
And if you would like more information to schedule a consultation, you can visit utphysicians.com or simply call 888-488-3627.